Okay, welcome back. You're watching The Money Show on ET now. Health insurance. Unfortunately, this is a topic we haven't really discussed on The Money Show, but it's always good to sort of ensure that you guys have a refresher on the entire bit with respect to covering yourself adequately, especially when it comes to health insurance. And I guess all the more, right? We are in the midst of a health crisis. We've been hearing stories about people, unfortunately having to be hospitalized, and it just doesn't end there. Then you're served with these huge bills that come in from the hospital. So hence, we decided to bring on board Dr. Prakash. He's the MD of Star Health Insurance, one of the premier health insurance companies in India. So thank you so much, Dr. Prakash, for joining us today. Most of our viewers do have a group cover. They're salaried, they're working with a company, and the company does tend to provide them health insurance, which comes under group cover. But Dr. Prakash, is that enough? Especially the fact that we are in the midst of a health crisis.
Group cover is useful, but all depends on whether the employee alone is covered or he is covered along with his spouse and children and his parents and in-laws. So the second factor is the sum insured. So in a group cover, the two important things to be known is whether the employee alone is covered or he is covered along with his spouse, family, parents, in-laws. And the second thing is, what is a sum insured? Because some of the groups, they have an adequate insurance coverage, whereas some of them have very less coverage. So the individuals have to know what is a sum insured they are covered.
Okay, so sum assured, I'm glad you brought that point up. How do you decide what's a sufficient sum assured?
See, as a doctor, medical doctor in the health insurance space, I frequently get this question. Ideally, the sum insured for an otherwise healthy family should be 5 lakh. But in the family, if there are some people who have comorbid conditions like diabetes, hypertension, heart disease, morbid obesity, then probably they have to go for an increased sum insured. But the ideal sum insured for an otherwise healthy young family should be 5 lakh, because today advancements in medicines are on the rise. Our per capita income is also on the rise, and medical awareness is increasing. So unless we have a sum insured of 5 lakh, it will be very difficult to address most of the common medical emergencies or elective problems that one encounters.
Okay. Yeah, I guess sometimes many people do get confused as to what should be an adequate sum assured, because that as well would sort of defeat the purpose, I guess, of not having a proper health insurance policy, even if you do have one. Do you recommend a critical health insurance cover apart from the basic or plain vanilla health insurance policy that I already have?
Health insurance is for people who are relatively healthy. It is not for people, but as a doctor, I see that most of them call me when they are diagnosed with the disease and ask about the options of buying a health insurance, where most of the companies are going to offer them an insurance when they are diagnosed with the disease. So health insurance is essentially for people who are healthy. And if you want to know about a basic health insurance cover or a critical care cover, a basic health insurance is a fundamental requirement, like food, clothes, and shelter. Everyone should also have a basic health insurance cover. There is no second thought about it. Whereas a critical care cover, if the individual is otherwise healthy at present, and unfortunately he suffers from a critical illness like a heart disease or a lung disease or a kidney disease requiring transplant or a liver disease which is deteriorating and all that, then it incurs a lot of expense, which may push him into financial instability. In that situation, a critical illness cover is going to be very helpful, because he is going to pay a very small premium, But in case, in the worst scenario, if he's diagnosed with a major ailment, he will get a very huge sum insured. So critical illness is going to help people who are going to be diagnosed with a major ailment which requires few lakhs for treatment. And all people should come forward and take a critical illness. If they don't fall victim to any critical illness, they are only helping another person who is in need. So on the whole, it is a very noble concept. So people need not think twice, whether is it required for me, is it useful for me? Go ahead and buy it. It is like an offering that you are doing in any holy place. Okay, if the individual is affected, it is going to help him. If he is not affected, that pool of money collected is going to help another person who is in need.
All right. Okay. Dr. Prakash, people have two options right now in the midst of the the coronavirus. Either they can just sort of top up their existing health insurance policy to be on the safe side, or then they can take out the Corona Kavach, which the government has sort of announced as a standardized insurance policy for coronavirus specifically at a very low rate, and insurance companies like yours are providing it to customers. So what would you recommend between the two?
Corona Kavach is an indemnity policy, meaning if there is an admission due to corona positive scenario, the whole expense for the treatment is covered under Corona Kavach. But my advice is, important points what I want to convey in this pandemic season, if somebody has already got a health insurance cover, it naturally covers corona admissions also. Because COVID-19 is like any other disease, like a bacteria or a virus or fungi or any, like it is one of the infections which anyone can encounter. So existing health insurance policies are covering already any admission related to COVID-19 positive. Now, what a common man should do is the existing policy, if he already has a policy, is a sum insured adequate? If he has a sum insured of 2 lakh or 3 lakh, it is not going to help him. You are seeing in the media what is the average cost incurred on COVID-19 admissions. Because these patients, of late, we find that they require admission for 10 days, 12 days, or 15 days, because from day 8 to day 12.
Okay, all right, fair enough. Dr. Prakash, there are going to be a couple of changes as well that the IRDAI, has introduced in making health insurance policies much more customer friendly. So I want to talk to you about some of those. Let's start off first with the standardization clause. Many times, people may not understand the jargons that come along with an insurance policy. How do you think the standardization clause solves that problem?
See, today, if somebody wants to buy a health insurance policy, the policy terms, features, honestly, I can tell you, it is very complex to understand for a person even in the financial sector. So, if somebody is buying a health insurance cover, so what is a sum insured? How many people are covered? What are the waiting period? What is called a standard exclusion? If somebody is already suffering from diabetes or hypertension, when will they be covered for admissions related to such diseases? There is a lot of ambiguity and people are not clear, because every insurance company has close to 30 to 40 products, and there are 33 plus health insurance companies. Imagine hundreds of products available. It is very difficult for a common man to choose the right product. So to break this complexity and to make health insurance easily understandable to a common man, Health Insurance Regulatory and Development Authority of India, very nicely they have come forward with a policy with standard exclusion, so that everyone knows that any policy they buy, the waiting period, the exclusions, the rejection clauses, and the coverage of diseases and the modern ailments, whatever it is going to be standard for all health insurance companies. This is a very, very wonderful initiative, and I am very confident that this is going to boost the penetration of health insurance in India. A very welcome initiative. So this should break the myth in the minds of people. Some people do not have trust on the insurance companies.
Oh yeah, that it is. But let's also talk about the other two factors. One is telemedicine, but I want to get in your opinion on a more sharper note when it comes to out-of-pocket expenses. There have been some changes over there with respect to room rent, with respect to proportional, deduction on the basis of how much higher your room rent is versus what your policy allows you. If you could just sort of simplify that for our viewers as well. What will change, let's say if I'm hospitalized, God forbid, after October from my policy?
It's like the proportionate charges on room rent and investigations. For example, somebody gets admitted in a hospital in a standard room, and they want to get an ECG done. Supposing they pay 200 rupees for the ECG, the same ECG, the same equipment, and to be read by the opinion to be given by the same doctor. If the patient is in a deluxe ward, it is going to be 250. If they're going to be in the ICU, it is going to be 300. If they're going to be in the suite, then it is going to be 400. So this is called differential charges based on the room rent taken by the room, the accommodation type taken by the customer. There is a differential charge as such it is levied on every investigation. So these differential charges were originally deducted if somebody occupies a room rent above the limit of his policy. Proportionate, it is not only the excess room rent cost which is deducted in the insurance bill. The proportionate increase in the charges on the professional side or on the investigation side, everything was deducted before. But now regulator has come with an ordinance saying that these type of deductions should not be done and it should be made very clear. So with this standardization of exclusion, all these myths also will be addressed, and the insurance companies will go for it. In future, insurance companies will go ahead and they will try to empanel the hospital with the proper
all right.
cost.
Well, thank you so much, Dr. Prakash, for just giving us all, a refresher course, if you could call it that, on health insurance, the do's, the don'ts, and of course, what are the changes that the regulator has brought about to make the customer's life simpler. Quick break right here on the show.